I'm Jim Byrum. I'm an internal medicine and pediatric specialist, and I've been in practice here in Bentonville for the last 24 years. I first met Timesia back in 2001. She was struggling with difficulties with cervical herniated disc and problems with discs in her back, difficulties with pain. And soon after that, she was involved in a motor vehicle accident. She was actually hit by a car in the VA parking lot here in Fayetteville, and it knocked her down, and she struggled with difficulties with her back pain and neck pain from all of that, eventually having to have surgery for those ruptured discs. Then, in October of 2002, she had about a 3-week period of time where she had graying out of her vision of her right eye, with decreased vision there. And she was seen by a specialist and eventually had an MRI done, which showed that she had some swelling in her optic nerve. The initial diagnosis that we considered was optic neuritis, with the thought that she possibly had multiple sclerosis. And the recommendation was that she be admitted to the hospital. So she was admitted to the hospital and was treated with high doses of steroids to decrease the inflammation for what we thought was multiple sclerosis. She didn't have all the findings of multiple sclerosis at that time because it was just in the area of her optic nerve. But soon afterwards, she had another MRI that showed what we thought was a mass or a tumor in the left side of her brain, in a part of the brain called the thalamus. It's part of the central portion of the brain that is involved in a lot of the functions of the body, but on the left side. And when I remember when I first saw her with this, I really thought that this was a tumor. We considered that it possibly could be multiple sclerosis, could be a disorder called sarcoidosis, which is a poorly understood inflammatory condition of the body and brain. We even thought it could be a stroke. At that time, she received the IV steroids and had some improvement. And in fact, by 3 months later, that area of abnormality on an MRI had completely resolved. So we were still kind of questioning what this was. Some of the specialists, even a neuro-ophthalmologist, a specialist in eye and its effect on the brain, thought that this was sarcoidosis. But we did not have a clear explanation of why this had gone away in that period of time. In 2003, in about May of that year, she had an evaluation to see what her general functional status was. She was walking with a cane at that time. She had weakness in her left leg, and she had what's called a left foot drop, where she couldn't, whenever she would walk, the left foot would stay sort of limp, so she had to wear a device, an orthotic device, to keep her left foot perpendicular with her leg so that it wouldn't drag and trip her. And she had that left foot drop for quite some time, actually for several years before it finally resolved. She eventually saw a neurologist in August of 2005 who considered the diagnosis of neuromyelitis optica, or Devick's disease. This is a disorder that's similar to multiple sclerosis, though not nearly as common and quite poorly understood. It's a disorder where the lining of the nerve cells on the optic nerve and several different other areas of the brain, including the spinal cord, can become deteriorated, much like multiple sclerosis does. But we don't understand why it occurs, and very few treatment plans had ever been discovered for that particular disease. She had a test done by the neurologist, Dr. Davis, called a neuromyelitis optica titer, which turned up positive and made a diagnosis for her at that time. So she had struggled for several years with some symptoms, and finally there was a diagnosis for her. Yet the treatments that were available at that time were somewhat limited. Steroids were helpful to a degree, but he had recommended a medication called Rituxan. And so she began to be treated soon after this time with occasional dosages of Rituxan as an IV chemotherapy type medication, which had shown some promise in treatment of neuromyelitis optica. Between 2005 and 2008, she had had an MRI of her neck, her cervical spine, and her thoracic and lumbar spine, and she had what's called myelomalacia. Myelomalacia is a term for death of spinal cord tissue. So she actually had evidence of thinning of her spinal cord due to damage from something. We assume that it's neuromyelitis optica, but there was obvious evidence that she was showing some permanent damage to her spine at that time. During this whole time, she was struggling some with depression, having to be on antidepressants, and also struggling with significant pain, part of which may be related to NMO, part of which may be related to her ruptured discs, but she had to be on strong pain medications to the point that she had a lot of side effects from those, and eventually had to get off the strong pain medications just because of the side effects. She eventually was seen by another neurologist who continued the Rituxan treatments, but tried another couple of other anti-cancer type treatments called Cellcept and Imuran, both of which were poorly tolerated. In April of 2011, she had her first severe exacerbation or worsening of NMO, to the point that she had to be admitted to University of Arkansas Medical Sciences Hospital in Little Rock. She was having difficulties with severe left arm and hand weakness to the point that she could barely use them, and was having significant weakness in her legs also. She wound up having to be treated with Rituxan again, and then transferred down there for plasmapheresis, where they sort of washed her blood out and replaced it with other fluids to get some of the bad chemicals or whatever was causing the neuromyelitis flare to give her trouble. So they washed that out of her system, and so over a period of several days she was hospitalized, and then eventually had a 17-day stint in Baptist Rehab Institute in Little Rock for recovery. And after that time, she was able to ambulate about 100 feet, able to walk about 100 feet with the help of a walker. But she had obviously had significant worsening on her MRIs with abnormal findings in the cervical and thoracic areas of her spine, where she'd had evidence that there was active disease with the neuromyelitis optica at that time. After a couple of weeks at home, she had another severe flare of her NMO, and she called our clinic, and I just wanted to read the words that she said to the nurse that day. "Fingers not working, having some difficulty breathing today, can't use left arm at all, having spasms as well, weakness in the chest area, using a walker." She had called UAMS, a physician that was treating her, and that doctor had left, so she's on a waiting list. The nurse actually had a hard time understanding her because of her speech being so slurred. She said that she's ready for the Lord to take her. She said, "Enough is enough." She states that she has peace about it and she's ready to go. Says she cannot fight anymore. So I think that gives an idea about how severely affected Timesia was at this time in July of 2011. At that point, she was again admitted to UAMS, treated again with plasmapheresis and Rituxan. She actually got so sick that time that she was in the intensive care unit and she was having trouble breathing, and there was some concern for her life at that time because her breathing was so shallow. She eventually was transferred back to Concordia Nursing Home here, and I can just tell you that when I saw her at Concordia, she was basically in a fetal position, in the worst condition I had seen her in. She could not take care of herself at all at that point, and I did not really expect her to survive this. It seemed like the treatments that we had available for her were being ineffective, and she was continuing to have back-to-back flare-ups of her neuromyelitis optica, and it seemed to be a hopeless situation from a medical standpoint. In August 2011, she had another severe flare of her neuromyelitis optica and was again hospitalized at UAMS. This was beginning to be a recurrent problem for her and a severe problem. This time she took the standard treatment and eventually spent 2 months at Health South Rehabilitation in Fayetteville, where they really worked with her quite well to try to get her back up on her feet, and she was able to walk with a walker after that period of time. Over the following year, she had flare-ups based on minor symptoms, vague symptoms that she understood to be a flare-up of her neuromyelitis about every other month or so, where we'd give her steroids. She didn't have to be admitted to UAMS or the hospital significantly over that period of time, but she obviously was continuing to have difficulties. Then in late 2012, she came in to my clinic and asked me what I thought about stem cell transplant, doing a stem cell transplant. And this apparently was experimental type treatment that had been offered in Chicago by Dr. Burt, and there was some evidence, but not a lot of evidence, that this was going to be effective for her. After numerous visits about this, and after she talked to Dr. Archer, her neurologist in Little Rock, who really recommended against the transplant, she decided to have the transplant. I remember her asking me right before she was going to proceed with the transplant whether she should do it or not. I said, well, Timesia, from a medical standpoint, I would have a hard time recommending this experimental treatment, but in your situation, I think I would do it if I had the opportunity to do it, because she was facing a life of extreme weakness and possibly an early death from this severe disease, and it already had showed that it was damaging her spinal cord. So she decided to undergo the transplant at that time, and so that was done February 21st, 2013. They did the stem cell transplant with all of the complications and hospitalization and expense of that procedure. And she struggled to get through that with all of her medical illnesses, but was able to do reasonably well considering all of that. She's now about 2 years out from her transplant, and she has not had a flare of neuromyelitis optica in that 2-year period of time. Now, to look at her now, she walks with an unsteady gait some of the time. She will trip over things at times, but she is able to walk without a walker, walk without a cane, and she's able to walk up and down steps, which is a lot more than what she could do around the time that these flare-ups were occurring all the time. So with the fact that she's not had any flare-ups and her gait has improved to where it has improved, I think she's had dramatic improvement. She also finished a physical therapy program called Live Strong, where she really worked on her muscle strength and has really improved with some of the strength, though she still has weakness. And I think that weakness that she has is related to the damage to her spinal cord from the previous episodes of neuromyelitis flares. Her test for neuromyelitis is still positive, so we can't know for sure whether it's completely resolved or not. But the fact that she's gone a couple of years without a flare when she was having them so severely in 2011, and then nearly every 2 months for the following year and a half, I think it's very reasonable that she may be considered cured from neuromyelitis. I think time will tell, but there's no question we can look at her now, and I just think back to those times when she was in Concordia nursing home and couldn't feed herself, couldn't sit up, couldn't stand up, couldn't take care of herself at all, and I realized that she's made dramatic improvement.